As I mentioned, thanks again for joining us for office hours. Today's topic is schedule with Google. We're super excited. My name is Hensley Erath, and I'm a customer success manager here at Luma Health. I've been at Luma a little over 2 years now. I work really closely with specialty clinics and super excited to have everyone on today's call. And I would like to introduce Gil Gordon, who's a product manager at Luma, and I can let him take it away from there.
Thank you, Hensley. So yes, my name is Gil. I think I've actually met a fair number. I was looking at the names on the list. And so for the folks who I've met before, nice to see your names again. And for the folks that I haven't yet met, my name is Gil. So if Hensley, I think, is still in North Carolina, and Jeremy, who's behind the scenes from our marketing team, who's running the show here, I think is in Denver, I'm in San Francisco. And I have been here for a couple of years. And I am focused on, we have a few PMs. My focus is largely on scheduling, which is why I'm so excited to show you what we're doing with Schedule with Google. So if we could have the next slide, please. This is basically what we're going to cover today. And none of this should be a huge surprise. But first, I'm going to tell you what it is. And then we're going to dive into, okay, well, what does it actually do for me? What does it do for our patients? And what is it, we'll touch a little bit on what Google gets out of it. And we're going to spend, a chunk of our time on that. And then we're going to spend a little bit of time peeling back the curtain a little bit and showing you how it actually works, just enough to answer, hopefully, any questions that you have from seeing what it does to actually understanding how we actually do it. And then assuming the demo gods, if we can go back to the internet for 1 second. If the demo gods cooperate, I will be able to show you a quick demo of what it looks like live rather than just screenshots. And then we can talk a little bit about the results that we've been seeing so far. And then we should have plenty of time to answer any questions that you guys have. So I think now we can move on. Oh, and also just as we're going along, the Goldcast tool that we're using has a QA section, so you can ask questions there. And at some point, we're going to have a poll, which should be fun, where you can answer some questions too. So let's get into it. So what is Schedule with Google? So you're actually looking at it right there on the screen there. So it is Luma. Well, it's Google search results. So, your patient goes and looks for something in Google and finds your providers or finds your practices and sees their Google business profile page. And that's what we're showing there. And what Schedule with Google does is it takes your appointment availabilities and puts them there along with booking links. So it's your appointment availabilities, it's shown in Google, and it's built off of your business profiles for your providers and your facilities. And if we go to the next slide, we can sort of dig in a little bit deeper into what that actually means. So, and this, we're sort of taking the point of view of how this really helps your patients, but really it's all kind of intermixed, and it's going to be how it helps you, how it helps your patients, how it helps Google. So when a patient is on this screen and they go and they see, let's say that they're a new patient and they can see that there's an appointment on August 22nd and they want to book it, they click that book button right there, and they get taken directly from that book button to the screen that you're seeing over on the right. So that is for folks who are familiar with it, it'll look very familiar. It's a Luma scheduling form. One interesting thing to note is, there was no other middle screen here. There was no welcome. There was no other questions. It got taken, the patient gets taken immediately to see the availability. So you can see that it's, Google said that there was an appointment today, or this was a couple of days ago on August 22nd. And when they clicked on it, they actually saw that there was an appointment on August 22nd at that time. And if they clicked on it, then they would continue down the booking flow. So I just want to pause on that for a second. Oh, if we can go back, sorry. The interesting, there are a few things to point out about this. So one of which is that this is a Google requirement. So Google, in order to set this up, requires that when a patient clicks that book button, the first thing they see are availabilities, not anything else, not other questions. And, from the Google point of view, they have it there so that they can crawl the information that we provide to them to populate those links and verify that it's actually correct. So when we say that there is an existing patient appointment for this provider on this date, they can go and click through and have their crawler verify that it's really there. So that's great for Google, but it's also great for your patients because they don't end up feeling sort of bait and switched, right? If they click on the book and then they have to answer 15 questions before they actually get to see when the slot is, and only to find out that they can't actually make that slot, patients tend to get frustrated. And obviously for you, our clients, this is great because we believe that by pushing the availability much earlier in the flow, patients who have committed and picked a time and sort of mentally said, okay, that's when I'm going to the doctor, were more likely to fill out the rest of the form and answer any of the questions that you need answered. And Kelly, I see your question about PS Plus forms for these, and I'll get to that in a second. But if I don't, we'll get to it at the end. Okay, so let's see. We can move on to the next slide. So how does it help you, right? So a lot of this is around, if you have a investment in trying to acquire patients off of search results, trying to make yourself available out there to your patient population or your possible future population, your entire market, so that they can find you. Any investment you've already made in that area gets leveraged by this functionality, right? So you've done work to improve your search engine optimization, or you've done work to build your business profiles, and now Schedule with Google on top of that allows your patients to book directly from those pages. So I think the next page is a poll. And Jeremy, if you have the magic buttons to make the poll happen, that'd be great. Sorry, this tool is new to me, so this is my first time running it, so forgive my excitement. Going to the polls tab. All right. Oh, and if people can't see it, the poll is just asking, do you actually manage the business profile pages for your providers? And I'm seeing the results coming in now, and it's almost evenish for yes and no, but nobody said what the heck is that. So I guess that is good news, right? So that interesting results will hopefully be able to tally them all up at the end. Oh, the yeses are winning right now. Okay. Well, let's keep on going. Okay, so more on how it helps everybody. So this is sort of this is obviously a help to you and a help to your patients, and this is built on top of our PS Plus form. So the entire power of that is available to Schedule with Google, and really what it means is that you can craft your scheduling experience to ask exactly what you need and only what you need and nothing else. And hopefully you can make it so that you get the important information that you need in order to book the patient, and the patient gets in and out as fast as possible through this flow so that they can actually get that appointment on the books. So on this screen, you can see, it's just obviously in order to book a patient, you're going to have to get some information about them. So patient information, this is very standard stuff. Jane, will get to your question too in a moment. If we go forward one screen, we can see other things that we are building or that you can do using our scheduling forms, right? So if you're interested in, let's say, asking the patient why they're visiting, and this is a free form text field, and you can have this written back to the appointment note itself so that it's available to your staff when reviewing the schedule or when talking to the patient in the visit itself. If we go one more, we can see just a little bit more of the standard form things we can do, right? So here we have an example of a branching question. We're asking about insurance, and the patient can pick one or answer the other, and based on what they decide, they'll get taken to a different path of the form, which may lead them to other questions or possibly even a dead end that doesn't allow them to finish scheduling. So why don't I pause there? And I think I'll answer some of these questions while they're here. So Jane asks if this comes in other languages other than English. And at the moment, we support English and Spanish and Portuguese too. Not that we have a huge demand for that at the moment. So the same languages that we support for forms today. And then if you think about the way a form is structured, there's sort of the core elements, and then they're your specific elements. And then your specific elements would need to be, if your question is, will you be using this insurance for this appointment, we'd have to get that translated and loaded into the form into Spanish as well. And then Jane also asked, how do patients actually find this on Google? So that part is kind of outside of Luma's control. So basically, when we get to the demo, it might be a little bit clearer. We can play around with that and sort of show you some of the ways that this actually comes out. So why don't we save that question for the end? But to answer Kelly's question, do you have to create a new PS Plus form, or can you use an existing PS Plus form? So what we've been doing so far for most people is using starting with an existing form and modifying it for the purposes of using Schedule with Google. Because Schedule with Google requires the availability to be first, you can't just use your existing form as it is today. But if you have a form you like, it's very easy to duplicate it and make that the start point for Schedule with Google. And Susan, thank you for letting us know that Ukrainian is popular in your area. Okay, let us keep on going to the next slide. So this might help answer a few questions that are probably brewing in people's minds right now about how this actually works. So the text that you're looking at there, there's no quiz on this one. You don't have to look at it too deeply, but this is actually a snippet of the data that we are sending to Google. So you don't really need to worry too much about it, but one important thing to know is that we're not sending any patient information to Google. So if you're looking at that closely, it's really just EHR data around your providers and around your facilities and around your appointment types, and when there are available slots for them, and then what link should actually be used for scheduling purposes. So that is the information that we're sending to them. I say you don't need to worry about it because once it's set up, it's automated, right? So this information gets sent every hour to make sure that there's fresh information going to Google, so that when they tell somebody that there's an appointment on the 25th, there really is an appointment that they can book on the 25th. Fully automated and sent on the hour. And then it's also fully customizable, right? So you get to decide which appointment types to send. You don't have to send all your appointment types. You don't have to enable it for all your providers. Obviously, you can if you want to, and you don't have to enable it for all your facilities if you don't want to. So, and then Ali asks, do these actually get converted into appointments on your EMR? Yes. So same as other Luma's scheduling capabilities, when the patient actually clicks book, it will actually get booked on the EHR. Same exact way it does in all our other scheduling. So that's how it works. Let's see, was there anything else? Oh, okay. Yeah, so let's try and do the demo now. So I'm going to try and share my screen. Let us see if this works. Jeremy saying I can't share screen while there's something else is being presented on stage. All right, now I can. So I can. Okay. So with any luck, you can see my screen, and now I just need to find it. Okay. So what we're looking at now is one of our clients that is actually one of our early adopting clients who is running this, and this is Chrome running a standard a search. And why don't I refresh it now? And if I was in the local area and I entered some other search term that made sense, it would bring up the result here. Because I'm sitting in California, I'm entering a pretty specific term just to bring it up. But here it is. So you can see here that we are showing, a different set of appointment types than we were looking at on the screen before. And you can see that they actually have different dates for their availability, right? So a new patient exam, you can come in on the 29th. An office visit or a physical, you can come in on the 28th. And just to show you what it looks like, we're not going to go all the way through in booking here because I don't think anybody would appreciate having fake appointments being put on their schedule. But let's click just a little bit deeper to see what it looks like. So when the patient clicks in, as we said, they get taken directly to to the Luma scheduling experience. It's customized for the client, and it's showing it's true to what it said, right? We said there was an appointment available on the 28th. And there really is. And if we click through here, then we would get taken to the rest of their questions. And we would book the appointment. So let's just look at one other example. So here we have another one of our clients that is, this is a pediatric dental practice with offices in Denver and Santa Fe and other places too. But let's look at this specific one here. So again, let's refresh this just to make sure that we're looking at the latest data. So you can see there are more appointments here, different types of appointments, and the dates are different too. So these guys you can actually get in, looks like this weekend, which is fantastic if you are trying to book dental appointments for your kids. And again, if you click the book link here, we would get taken to their particular scheduling form. And you can see this is, being hosted on Luma directly. And you can see it has their branding. And just for fun, let's see if this works. So this is, in Chrome, we're pretending to be a smartphone, and we are going to refresh this, and you can see that here are the results. You can see that they have these booking links too, and they look like they have different availability, right? So you're going to have to wait till Monday if you're in Santa Fe and want to book an appointment. But that is basically what it looks like live. So I'm going to switch back and stop sharing. And then, Jeremy, you can put us back on the deck if you have the power. All right. Yeah, so that was sort of super brief demo. Now we can keep on going. Okay, so why don't we go back to results? So I think I kind of mentioned this, right? We've had one client live with this since early March. We've had a couple more join more recently, so they have less of a track record. But for the client that's been running since March, right, they're seeing a significant number of their appointments actually that are getting booked by Luma being booked through those book links on the Google search results. So it varies across the different providers that they have enabled for Schedule with Google, but it's, on average, 25% of their appointments that they're booking through Luma are getting booked through Schedule with Google. And obviously, we can't claim that those are all like entirely net new, because some of those patients probably would have done that search, clicked through to the link, and actually booked the appointment. But we think that it's a significant increase on what they, there probably would have been people who would sort of get lost in the funnel and not make it from the Google search results to the page to the scheduling link. And so we've cut out a couple of stops on the way, and we think that the results are very good. So other things that we've noticed, a couple other things, like where can you see these results for yourself? You can see these in Google, in Luma's built-in reporting. You can go to the pre-scheduling report and just filter by the scheduling form that you're using for Schedule with Google. And that way you can see which of your appointments are coming in through Schedule with Google and which are coming in other ways. And other kind of little anecdotes that we're seeing a lot of, weekend bookings, we've seen people, at that dental practice, people, coming in over the weekend and booking, 3 appointments for next week for their 3 kids so they can get seen. So, all kinds of serendipitous booking like that, which makes us very happy. We're not entirely yet sure what kind of conversion rate to expect. On the one hand, we expect many more people to see these links, so maybe you'll get a lot of more people, just looking around, as we were doing just a couple of moments ago when we were doing the demo. But also, once people actually click on an availability, we think that they're going to be more inclined to actually schedule that appointment. And then other results we've seen for the providers that are allowing, and all the providers we have right now are allowing new and existing patients to book and sort of ask the patients to self-identify. And so far, looks like around 3/4 of the patients are new patients or identifying as new patients. And, they're not 100% accurate always in identifying themselves as new or existing patients, but that seems to be what we're seeing. So those are the results. And I think questions have been adding up here and I haven't been answering them. So we can jump to the next screen and start answering questions. Oh, no, before that. So Help Center resources. So this is, on the Help Center, you guys all have access to it. Lots of useful information there, not just release notes, also, lots of answers to many of the questions you might have. There's an article there about getting started with Schedule with Google. It talks a little bit about the functionality. It talks very little about the setup because at the moment you need our help to set this up. So this is not yet a self-service setup thing. So, talk to us if you want to get signed up for this. All right, I think that takes us to QA. So I'm going to take them from the top, which I feel like is okay. And if I click this answer button, no, that's not the one I want. I want to click the share button. Okay, so hopefully you can see Deborah's question there. So how is the data safe going through Google? Yeah, so lots of people have this question, and I think the answer is kind of two parts. So one is we don't send Google any information about your patients at all. There's no PHI going from us to them. We send them, as we said before, the information about your availabilities, and we also send them once a week aggregate data from all of Luma saying this is how many patients saw Luma scheduling forms, and it's just a count, 100, 1,000, 10,000, and then another number which is how many of them actually converted. So that's all we're actually sending to Google. So we feel like it's pretty safe. And then sort of the other question is, what is Google doing with that data? And for the purposes of Schedule with Google, all they're really doing is verifying that we're sending them accurate information and then presenting that on the screen. It's also very easy if you decide at some point that you don't want to be sending this data to Google anymore. You just, we turn the feed off, and we're only sending, a few. The data that we send them would get very stale very, very quickly, right? So if we cut off those feeds, they're not going to have useful information for you, within a short number of cycles. So I think that answers that one. So how we're structuring costs. So that's definitely sort of a conversation that you should be having with your account representatives. It's basically, thank you for bringing that up. The sort of from a licensing point of view, you have to be able to do scheduling in Luma first. So that's sort of the base requirement. And then this is an additional product offering on top of that. So that's how it works. So I'll close that one and then share another one. So is there a handoff option if the patient calls the office after initially starting on the phone for Google? Otherwise, I have to ask the patient to Oh, I see what you're saying. So I think, Michael, and I think you're definitely saying this, right? Like say they get halfway through the form and then they realize that they can't, for some reason, either they realize or you realize that they can't answer it at the moment. And then can this information be saved? I will have to get back on that answer because I'm not 100% certain if the form is complete enough there for us to be able to trigger something and send it to the staff so that the staff can see it when a patient calls about it. I think the answer is yes, but I'll need to double check that. And then let's share this one. So Kelly, how often do the appointment times refresh? So yeah, as you're sort of intimating, there's two flows, right? There's whatever Luma is doing to get your availabilities from your EHR, and for most of our clients, that's every 15 minutes. And then there's how often Luma takes that information and sends it to Google. So we do that. Google wants it, no more than every 15 minutes and no less than once an hour. At the moment, we're sending it to them once an hour just so that we don't overwhelm everybody's system with too much data. Every hour is the answer. And as you saw, or hopefully you noticed on the Google screens, they're not showing individual time slots. They're just showing days. So if they, you send them, 9 a.m., 10 a.m., 11 a.m. availabilities today, they'll just say, there are appointments today. All right, let's stop sharing that one. Does it accidentally allow let me share the question. Jane asks, does it accidentally allow two patients to schedule for the same appointment? So not through Schedule with Google, right? So let's say there were, you're doing a mass vaccination event, or I don't know, whatever the example is, right? You have a certain amount of stock of availabilities. Once the patient clicks that, the little lozenge to pick that time slot, that appointment is held for them for a few minutes, right? And it's actually a setting, and I think by default it's set to 15 minutes, but basically that won't be shown to anybody else. So it's unlikely that another Luma person will go in and book that during the same time frame. It's possible that if you have people scheduling in other places, right, if they're scheduling directly in your EHR, that those availabilities might get taken from underneath the patient, in which case the scheduling failure is as nice as we can make it, right? We say that unfortunately we weren't able to book it, and then we can list the number to contact to actually book it, or the patient can try again. So that's how that works. Let me stop sharing that one. How often, how restriction costs? Does Google track clicks? Oh, let me share. So Marcella asks, does Google track the clicks for each appointment request? So Google is not sharing with us exactly what they're tracking, but I mean, I would assume that they are tracking everything. All right. And let's share this one. So Kelly asks, I'm not going to read this out loud. I'm just going to read it to myself so you guys can all read it to yourselves too. I'd have to think about this some more, Kelly. I think this would work, but we can definitely dig into that. I mean, generally, yes, we support typed availabilities. I'm just thinking about the interaction between what you want to show on your Google versus not Google scheduling flows. But in general, we should be able to accommodate this type of scenario. I'm not sure if exactly in this way or in some other way. All right. I think we've already answered. Let me see. Hensley or Jeremy, do you see other questions that we haven't answered? I think I've scrolled through them. Oh, is there any other crossover with Schedule with Google with current waitlist functions? Nothing all that. There is no additional functionality there. No. So it's basically showing your current stock of availability. So hopefully folks are managing to find those and book them directly. All right, I'm scrolling up and down the list. If any other questions come up as we've been talking, please let them know. Let me see if there are any in the chat. No, I think these all got sent to QA. Well, thank you guys for letting us share. You can obviously reach out to me. I am Gil at lumahealth.io if you have any more questions. But I'm going to hand it back now to Hensley to wrap us up.
Great. Thanks so much, Gil. Yes, as Gil mentioned, if you do have any questions, you can email Gil, but you can also reach out to your customer success manager, and they can get you pointed in the right direction of who you need to be in contact with. And if there is no more questions, then we look forward to everyone joining us next time. For office hours for the month of September, we are actually going to incorporate this into our Illuminate event, which is September 6th and 7th. If you were not on at the beginning of the call and maybe join later, feel free, if you have not RSVP'd, to reach out to your customer success manager if you're interested. If not, we hope to see everyone there, and we look forward to seeing you back at the October office hours. Thanks, everyone.